Assalamualaikum warahmatullahi wabarakatuh. My name is Radiography from 1 class A. Now I want to tell about is technical examination of Pedis radiography in osteomyelitis cases. Abstract. Pedis is a leg bone consisting of 26 bones and 13 joints as well as muscles, tendons, and ligaments. The bones that make up the pedis consist of 7 tarsal bones, 5 metatarsals, and 14 phalanx. Human media can be divided into 3 parts, namely hindfoots, midfoots, and forefoots. Hindfoots includes the talus and calcaneus, which make up the exterior of pedis. Midfoot includes cuboid, navicular, and 3 os cuneiform, which make up the medial pedis. Finally, the forefoots includes a toe consisting of 3 phalanx or toe segments, expert the thumb or helix consisting of 2 phalanx. Background. Radiology examination is an examination that can be used to determine the anatomy and physiology of a person so that pathological and traumatic disorders can assist in determining the diagnosis. Pedis is a leg bone consisting of 26 bones and 13 joints as well as muscles, tendons, and ligaments. The bones that make up the pedis consist of 7 tarsal bones, 5 metatarsal, and 14 phalanx. Next, osteomyelitis is an infection of the bones, derived from the words osteon or bones and melio or bones marrow, and combined with its inflammation to describe the clinical condition in which bones are infected by microorganisms. And then acute osteomyelitis is mainly found in children, generally infected with long bones starting in metaphysis. The bones that are often affected are the distal part of the femur, the proximal part of the tibia, the humerus, the proximal and distal portion of the radius and ulna, and then the vertebrae. The most common cause of osteomyelitis is Staphylococcus, Streptococcus, Pneumococcus, Salmonella, and mushroom and virus. Next discussion. Prepare X-ray plan, preparation, X-ray plan, radiographic tapes and films, marker, apron, and softback. The radiographic techniques performed to show osteomyelitis abnormalities in Pedis are 1. Epi-projection aim to show the anatomical picture of Pedis from the dorsoplantar sides. Patient position. The patient supine on the examination table. The position of object. Adjust 1. Adjust the knee and plantar pedis examined to stick to the examination table. 2. Set another leg extension. 3. Longitudinal cassette position. 4. Ensure there is no rotation on the feet. Finally, provide direction to the patient of clamp down during the examination. Light and exposure setting. CR perpendicular of 10 degrees posterior. CP on the base metatarsal digit 3. SID 102 centimeters, and then exposure factor 14.5 kV and 4 MES. The projection of 2. Oblique projection and to show the anatomical picture of Pedis from oblique. Patient position. The patient spines of the examination table. The position of object. A. Adjust the knee and plantar pedis examined to stick to the examination table. B. Set another leg extension. C. Attach the foot medially. D. Longitudinal cassette position. Finally, provide direction to the patient to clamp down during the examination. Light and exposure setting. CR perpendicular to the cassette. CP on the base metatarsal digit 3. SID 102 centimeters, and then exposure factor 14.5 kV and 4 MES. Radiation protection. A. Use an apron to cover the patient's pelvis so that the reproductive organs are protected from X-ray. B. Set the area of collimation. C. Giving direction so that the view avoid X-ray. Next, radiographic evaluation. 1. Epi projection. 1. No rotation of the foot. 2. Avoid amount of space between the adjacent midshaft of the second through 4 metatarsal. 3. Overlap of the second through 5 metatarsal space, and then visualization of the phalanx and tarsal distal to the talus as well as the metatarsal. Radiographic evaluation 2. Oblique projection. 1. 3 trough 5 metatarsal base free of superior position. Lateral tarsal is less superior position than in the api projection. Lateral tarsometatarsal and inner tarsal join sinus, and then sinus tarsi, tuberosity of the 5 metatarsal, 5 of the first and second metatarsal, and then equal amount of space between the top of the second of 5 metatarsal. Finally, sufficient density to demonstrate the phalanx, metatarsal, and tarsal. Conclusion: OSA examination Pedis in the cases of osteomyelitis use oblique projection because which the projection can alright show the suspect disorder in OSA Pedis. One of them is osteomyelitis. In OSA Pedis radiographic is the case of osteomyelitis. Much needs detail and sharpness of the image. In my scientific rating for OSA Pedis radiographic examination, small focus should be used that is useful to improve the detail and sharpness of radiographic image. Okay, the describe finally. Wassalamualaikum warahmatullahi wabarakatuh.